Hey, how's it going?
It's good. We had a great session today with Cat Myklebust.
Yeah, she was amazing. I loved her.
Yeah, it's so pertinent for our practice. Just lots of patients in common and dealing with the same problems.
Yeah, she's helping a lot of women.
Yeah. So Cat is a teacher. She's an instructor. She's been involved in the fitness industry for a long time. And she's now really focusing on strengthening the pelvic floor and doing it in a very scientific way and teaching people about breathing techniques. And I think it's fascinating what she's able to do and how she's able to help patients be more healthy.
Yep. It's a great episode. We hope you enjoy it.
Thanks.
Yes.
Yeah. Are we ready to go?
Yeah, we're recording. All good? Yes, we can start.
Cat Myklebust, great to have you on the Vagina Doctor Podcast.
Oh, thank you for having me. I'm really excited to be here today.
I'm going to learn a lot.
Did we do her last name right?
Yes.
Okay.
Yeah, yes.
You can include that again.
I just want to make sure. My first interruption of the
Oh, no, that's okay. Yeah, my son, when he gets announced for baseball, when he comes up to hit, they say the last name wrong every time. And my daughter's in the background like, it's Myklebust.
That's so cute.
So,
Sorry.
Go
on.
Cat Myklebust, it's great to see you today, and thanks for coming on the Vagina Doctor Podcast.
Oh, thank you so much for having me. I'm glad to be here.
Well, we're going to learn a lot today, so I'm really been looking forward to this. You've been in the fitness industry, you say, since 2006, but you were in graduate school doing physics and teaching physics, and one day you thought, I haven't had a smile on my face all day, until you got into your fitness class, your group fitness class.
Yes.
And something clicked for you.
Something clicked. Like being in physics, it was a good experience. I learned a lot, and I learned a lot about teaching people, because that was my favorite part, was teaching people physics. Not so much the lab work, but I love the teaching part. And I realized how important it was to make people feel like happy and good, and, have them find that in themselves. And we found that through fitness, not physics. So physics oftentimes doesn't make people very happy, but fitness does. Like after a class, you're smiling, you're happy.
Yeah, right.
And
you survived.
Yeah, and you survived. Yeah. And I realized that I felt like I was so many steps away from helping people when I was in physics. Like, yes, physics does help people. And my sister is a great example of how she uses physics to help people. But I felt passion for fitness and making people feel confident in their bodies and finding new ways to find joy through fitness.
And you went on to become a master trainer for Beachbody Live.
Yes. So I trained instructors how to teach a class called Turbo Kick. It's like a crazy cardio kickboxing intense class. And then also Insanity. And we had dance classes and like a Pilates yoga class. So all of that, I would travel the country and train people how to teach those classes.
Yeah, remember that was huge. That was back in like the early 2000s. Was that Beachbody became really...
Yeah, that's when their infomercials began to get really popular. And then I worked for a different company, and then Beachbody bought that company. Okay. And then we kind of helped create their whole instructor training program.
Got it.
Yeah.
And then you got pregnant.
Yes, I got pregnant. And I'd been in the fitness industry for probably like 7 years at this point. And I was just like, I have no idea what I'm supposed to do. Can I still teach kickboxing? Can I lift weights? Can I do this? Can I do that? I had no idea. And I was like, well, if I don't know something, what I like to do is I like to figure out the answer. So I found my first postnatal fitness certification, and it was very empowering because they talked about how, like, yes, women can do almost anything when they're pregnant. Yeah. As long as, you're doing it safely and you are aware of your body. And that was the first time I heard about the pelvic floor. And I was like, what is that? And I've heard about Kegels. That's what all the doctors said, like, do Kegels, you're pregnant, do Kegels. But then I was like, why am I even doing a Kegel? And then I found out more about the pelvic floor. I'm like, oh, it's a pelvic floor contraction. And so everything started to come into place. And then second kid, I was still teaching like all my intense kickboxing classes and everything. And then kid number 2, I was like, well, I still don't feel like I know enough. Like I know enough to be able to teach someone else. And so I did more certifications for postnatal and pelvic floor health. And I would say I'm still continuing on that path. I'm still researching. I'm still trying to find new studies to help promote and to also back up what I'm doing with my clients now.
And you probably found, and I can say this as a past OB myself, is that your doc knew nothing about this. I mean, other than telling you to do Kegels, that was the sum total of what your doctor was able to tell you about exercise and pregnancy.
Yes. And she was an amazing doctor, but that's also, her specialty was to make sure that I was healthy and that baby came out okay, and she did that. She succeeded at that. So
the pregnancy is such a damaging time to the woman's body.
Mm-hmm.
It's huge, and it's damaging, and some things can't be repaired,
mm-hmm.
but a lot of it can. And so when I was thinking about talking to you today, I was thinking, okay, it's how, we'll talk about Kegels, we'll talk about the amount of exercise that is okay, and what is a good recovery method afterwards. But then I saw what you sent to me. And so we have an entire lecture on the pelvic floor here that is far better than I can do. So I'm just going to give this to you and just tell us about it. Tell us what you think is important here. And we'll interrupt you if we have questions, but feel free. We're still going to chat.
I've always been confused about the whole Kegel thing.
Okay.
Because I feel, and I do talk to patients who go to pelvic floor physical therapists and they say it doesn't work. It didn't work,
mm-hmm.
or they're frustrated. So that alone, I have questions about.
So let's talk about that. Let's talk about the difference between a Kegel and a pelvic floor contraction and how they're the same and how they're different. So a Kegel, we've been told to stop the flow of urine. So
Mm-hmm.
like if you imagine going to, and please don't do this. I don't want people to actually stop the flow of urine. Unless like you need to, but if you're actually going to the bathroom, please don't do that. But if you think about your urethra, it's pretty small. And you think about your entire pelvic floor, it goes from your pubic bone to tailbone and then sits bone to sits bone. So I like to say it's a diamond shape. So if you're talking about contracting your body just to stop the flow of urine, you're contracting this teeny tiny portion
Mm-hmm.
of your pelvic floor. And there's pelvic floor that goes all the way back to your tailbone. So it goes past your vagina and past your anus, and you're kind of ignoring that whole part. And so what I try to do with my clients is, if you imagine a Kleenex tissue on the ground, if you pick that tissue up from the very middle, not only do the sides come in on that tissue, but it also moves up. So that whole pelvic hammock, it's not just one muscle, it's a big collection of muscles. It contracts in and up. And that's my difference between like your whole pelvic floor contracting or just the front part. But then you can go and contract just the front part, just the middle, just the back. And you can go through those and see if one is easier to do than the other. And so when I have a client, one of the first things we do, or maybe even the second, I try to get them to do a pelvic floor contraction correctly, because I've noticed that people, when they're like, okay, do a Kegel, they're like, and so I try to gently ease them into how to do a pelvic floor contraction. But more than that, I said that's probably the second thing I do. We talk a lot about breath work, like your breath and your diaphragm and how to use your diaphragm to
How to breathe.
How it is. I retrain people how to breathe. Like I teach classes called pelvic floor Pilates, and I always joke it should be called like diaphragmatic Pilates, because I talk about the diaphragm probably half the time, probably more than the pelvic floor.
Yeah.
So your diaphragm and your pelvic floor are very interconnected. Like I like to think of it like two little jellyfish that are just, floating on, they're swimming above each other. And so when one contracts, the other one gets a little stretch or it relaxes. And when the other contracts, then the other one relaxes. So there's a relationship that happens between them. And when we're doing just Kegels all the time, we're kind of breaking that connection between your diaphragm and your pelvic floor, and then even all your deep core muscles. So I really like to retrain people from step one. And then from there, we keep going and keep retraining the entire body. So I don't look just at the pelvic floor. I've had clients who come to me and they're like, I was just told to do more Kegels. Like, I don't know what to do. And I'm like, well, Are your glutes activating? Are you breathing with your neck and your upper traps all the time? Which I
Yes,
see that
I
a
am.
lot.
Absolutely.
So I like to retrain people on how to use their diaphragm and how to even feel their diaphragm. And, we've heard about diaphragm, like, oh, we have hiccups, it's your diaphragm. Or at least I heard that as a kid. And I had no idea what that meant. I just imagined something blocking my chest cavity from my stomach. That's all I thought it was. I didn't know that it was your breathing muscle. And so if you want, we can just kind of go through how to even feel your diaphragm. So I like to have people visualize this, and sometimes I have them sitting and sometimes I have them lying down. Just depends on the situation or even their mobility, if it's easier or hard for them to lie down on the ground. But instead of, I just have them take a few deep breaths because I like people to see what's going on naturally in their body before I tell them what to do. So I just tell them to take a few deep breaths and see what's moving. As they sit down, are they like, and I'm exaggerating everything.
Yeah.
And sometimes I do get people who breathe like that, but how deep of a breath can they take? Where does their movement go? Does it all come up here into their neck and their chest? Or do you see downward movement? Do you see their rib cage moving at all? Or do you see their belly moving out and in with their breath? And I like to tell them all the different muscles that can be moving. And then from there, like, oh, is it your chest? Like, what do you feel? What do you notice? And then from there, I'm like, well, now let's imagine that breath going into the very back of your rib cage. Like there's an umbrella opening up inside of your ribs. And every time you inhale, it all expands out. And so sometimes I see people who get really tense in the neck and they're trying to just like force that breath into their diaphragm. And so like I make people wiggle, shake, because that's all stress if you're just holding everything super tight. And we go into different positions for this too. So like I like child's pose a lot for it. And we move our rib cage around to try to feel that breath going into different areas. And I tell people all the time, like when you're at home, grab a throw pillow or something or a foam roller and round over it and have it push on the front part of your rib cage and your belly. And that'll force the breath into the back of your diaphragm. And they'll do that for a little bit and they'll come up and they'll be like, oh, I feel really calm. I'm like, yes, because you calmed your system down, your diaphragm. When you are using it and using the back part of your diaphragm, it actually stimulates your vagus nerve. And will tell you that you're in your parasympathetic state, your rest or digest state, your calm state. And once we can get that breath into the diaphragm, I feel like we get a lot more out of the workouts. And then you're also able to connect to your pelvic floor because every time you use your diaphragm, there's a gentle pressure downward on your pelvic floor. So it's a stretch for your pelvic floor. So those two little jellyfish I was talking about earlier, when your diaphragm contracts, it actually flattens out. It puts a gentle pressure down on your pelvic floor. So it's like a stretch. It's like if you opened up your arms and stretched your chest. And then when you exhale, just a normal exhale, your diaphragm comes back to its resting state and your pelvic floor naturally comes back to its resting state. So if we're not using our diaphragm to breathe and we're just using our chest, you start to seize up and not seize up, but like your diaphragm starts to get stiff. And that in turn can make your pelvic floor more stiff because it's just trying to hold the pressure in that is not being controlled in your abdomen anymore. And so that's it. I just talked a lot about the diaphragm and all that, but that's really where we start. And I just start I just watch people when they talk to me too. And what they do naturally, because that tells me a lot about where we need to go and what movement we need to change in their body, even just how they stand. So that's the first thing we do. We talk about breath. And a lot of the times people are like, I didn't realize I've been breathing with my neck this whole time, like the muscles right in the front of your neck. And you can hear people if they're talking, sometimes they go, and they tense up their neck. That's using accessory muscles. So instead of your diaphragm, you're using your neck or your upper traps, your shoulders. And so we just try to retrain the body to use the diaphragm. And that's the first thing. And sometimes it's the hardest thing, but that's something that I can give people as homework. Like you can do this. You can go home and check in with yourself.
Yeah, that makes sense.
Twice a day or once a day, sometime during the week, check in with yourself and see how you're breathing again, because you'll notice like, oh, when I'm sitting at my desk working, I am like this. I'm like a little gremlin and I'm just stressed in the chest and I'm not using my diaphragm anymore. So we find ways to relax and use that diaphragm again.
Like that. And then what's the next step from
So,
there?
so after we talk about that, then we start talking about forced exhales. And I think it's funny because I came from intense working out, like crazy cardio kickboxing classes. And the more you worked out, the more you sweat, the better it is, the better workout is for you. And now I have a completely different mentality on that.
I want to hear about that too.
And so for your pelvic floor, I realized I was just researching how to like activate your pelvic floor correctly. And suddenly I was like, oh, I'm teaching a form of Pilates. So I found Pilates in like a roundabout way where like, I was like, what's the best way to engage your pelvic floor? And I was like, oh, well, now I'm teaching Pilates. Okay. Well, I didn't know that. And so once we get the diaphragm going, we start talking about a forced exhale. So that is where you are blowing air out of your mouth, like you're blowing out birthday candles, or you're doing a ha breath, like you're fogging up a mirror. And what that does is it starts to get your deep core muscles engaged as well. And it is a natural lift for the pelvic floor. And that's how it should happen ideally. It doesn't.
Yeah, and that is very Pilates.
It is. It's very,
Yeah.
but
Because you can feel it. If you were just sitting here right now and you do.
yeah, if you just go, shh, you kind of feel like, oh, I do feel
you feel
that.
your pelvic floor.
Yeah.
Yeah.
And so because I came from, what was that like?
I don't know why I deserved a kick, but I got it. I'm listening, I'm learning, okay?
But also, I also have a lot of men who started to find me for like if they had prostate cancer and they got their prostate removed. It's a very similar thing. Like they're told to do Kegels also, and they're like, I don't even know how to connect to that. So it's the same thing. It's kind of the same training that I have to go through with them. So we start adding that forced exhale in, and that kind of, if you think about a piston, like in the car, like there's a pressure down, there's a pressure up. So when you start adding that forced exhale, it helps you control that intra-abdominal pressure, pulling the pelvic floor up as well. And ideally, that's what should happen, but that's where we try to retrain the muscles. So sometimes I do tell them to add a little bit of a pelvic floor contraction with that exhale. Sometimes I tell them to do a lot, and then sometimes I'm like, don't even think about contracting the pelvic floor, just use the breath. It just depends on where we are with them and with their bodies. And so you have all your deep core muscles. I like to think of them like a soda can. So the top part is your diaphragm, the bottom part's your pelvic floor, and then the sides of the soda can are your transverse abdominis and your multifidus muscles. So the transverse abdominis, that's like if you think of an old-fashioned corset that you put around you, it goes all the way around. And when you exhale, it's kind of like you're tightening up that corset. And then but that isn't just right here. It goes all the way, it goes down and up. And people think it's just around the waist. So they just want to squeeze around the waist, but it's that whole cylinder wall. And then the multifidus muscles, those are along your spine. They go along your vertebra. And so we do movements to try to incorporate those in there as well. And those deep core muscles, they're supposed to be anticipatory muscles. So if I'm going to reach out and shake someone's hand or take a step, those muscles are always kind of reacting and they're helping to support your core. And a lot of times we lose that ability because one, we don't breathe with our diaphragm anymore. And two, we just kind of have lost the connection with our core. And I see my kids who, when they sneeze or they cough or they yell, you see everything in their core come in. Like it naturally comes in. And I started looking at my own core and I was like, when I cough and I sneeze and I do this, I see everything push out. So whenever you're pushing out, you're also pushing down on your pelvic floor. And so I got into all this because I had been suffering from pelvic floor things for forever. And, everybody was just like, oh, that's normal. Mm-hmm. Yeah, if you do a jumping jack, of course you pee your pants a little, And I was like, this doesn't seem right. Like at a certain point, I'm like, but just because it happens to everybody doesn't seem like it should be normal. And like we have normalized it, but it shouldn't be normal. And I thought it was interesting going into my research that it actually affects young women who are athletes. Mm-hmm. So about 40% of young women are already experiencing incontinence problems because of that impact that they're having. Yeah. Like volleyball, you're falling on the ground, you're jumping up, you're hitting the ball. And like I heard another one with rugby, like when you're getting hit during a game or something, like that you get that impact.
And also just working with weights.
Yes, and working with weights. Mm-hmm. So That's another thing where I retrain people how to lift heavy weights, but still keep their core strong.
Yeah.
So it's fun because you can go anywhere with this, with what I do, but it's fun to be able to empower women. Like, we're told to lift weights, it's good for osteoporosis. As we get older, we need to lift weights. But how do you lift weights without just putting pressure down on your pelvic floor? So that's where all this comes in, that retraining of the core and the pelvic floor, and then using your breath to lift that weight. So using your breath. And I tell this to new moms, like, use your breath every time you pick up that baby, so that you're not just pushing out every time. Like, use that exhale, bring whatever you're picking up closer to your body, use the exhale to lift instead of like reaching over and grunting to lift up.
Yeah.
Which we've all done that. Like, you get out of the car and you're like, ugh. And I tell people, you can get out of the car, go use your exhale. It doesn't have to be like a huge exhale. It could just be a little one to help get all that intra-abdominal pressure to work for you and not against you.
I think this is so interesting because just those little things that you said, they're just small little adjustments.
Yeah.
And the difference it would make. Just adding those little bits of things.
And it's becoming aware of your body, because like I tell people, I only see you for 50 minutes, maybe once a week, like for my clients or people who take my classes. I see you 50 minutes and I can't control what you're doing the whole rest of the time. So I give them certain things to do, like check your breathing. Another one that I have them do a lot, I tell people to check if they're clenching their booty, if they're standing and just clenching their glutes and always clenching their glutes. And that's how their body finds stability, is just through clenching your glutes. And if you're washing dishes, always clenching your glutes, cooking dinner, getting something out of the car and always clenching your glutes, you just start pulling on your low back muscles. And it also makes it harder for you to activate your glutes. So I tell people they have permission, tell them that Cat told them, anytime they find that they're clenching their glutes, like they just shake their booty.
Yeah, but that's like something I've heard about from fitness trainers too.
To clench your glutes?
Yes.
When
you're walking fast, exercising, all these, like, let's say you're using walking as your main form of cardio.
Yes.
That you should be clenching your glutes the whole time.
I think that you should be able to naturally activate your glutes, which I do have to help people naturally use their glutes when they walk. And you don't want to be walking around and having something tense. Like, I wouldn't tell you to walk around and like just flex your bicep.
Yeah. Well, it's never made sense to me. I'm just saying that I have heard that. And I do a lot of walking and I'm like,
I think it's more so see if you can feel your glute activating on the extension, because that's the main movement that your glutes should be in charge of, is that extension of the leg backwards. And so what I've actually found with a lot of people who have pelvic floor issues is that when they walk or when they do anything where their glutes should activate first and then the hamstrings, it's like glute hamstrings, and then they both should activate together. I find that it goes hamstrings, low back, no glutes. And it just kind of skips over the glutes. And so they're like, why does my back always hurt? It's like, well, because you're never using your glutes. You're always using those little muscles in your back to walk.
Is that the way, though, people are built?
To have glutes activate first?
Yeah, in a way. Like the way someone is just built. Like, I have a very flat spine. You have a very curved spine.
Mm-hmm.
He's tends to use his glutes more than I would. Given our different body types.
Yes, and people are different with their body types, and their spinal curves. I look at that a lot to see where their spine sits, where their hips sit. But your glutes are your largest muscle. Like, they should be activating every time you walk, and then that is like I said, I retrain people to use their glutes, and they're like, I didn't even know that I like that this.
People definitely don't use their glutes a lot when they're lifting anything, getting in and out of their car. They should, you know what I mean? All that stuff. They just are using their low back.
Yeah. And we're told, use your legs. I'm like, but what does that even mean? Like, how do you, like, what, okay,
of course
use
I'm
my
using
legs.
my legs.
Like, but but it is like, one of my favorite exercises for people who don't use their glutes, it's a step up. Like, you can start really, really small. Like, the step up can be a few inches and then it can get bigger from there. But they have to put one foot on and they cannot use the back leg to push off. They can only use that front leg and that front foot. And your whole body is connected. Everything's connected. It's not like, that's why I say don't just do a Kegel. So if you start at the foot, and if you think of your foot like a triangle. So you have your heel, you have the ball of your foot, and then the pad below your pinky finger, or pinky toe, sorry. Then you keep that whole triangle down. But if you put a little bit more pressure into your heel, it kind of signals for the back part of your body to activate. And when you don't use that back leg, it starts to trigger the glutes. And like, it's really fun to watch, because you can see someone like they just want to use their quads. They want to use their hamstrings. And suddenly you see them like, oh, I just felt my glute activate on that side, and you can see them building that mind to body connection again, because we do lose it. We do lose that connection to our glutes, and sitting also really wreaks havoc on glute strength too, because you're just sitting all the time. But that's a really fun one to do with them, to try to just slowly bring back that glute activation. And then now, like, I get texts from people like, I just went up the stairs and I was thinking of you because I was using my booty.
Yeah, I think stairs are good. But even like you said, people typically tend to use their quads.
Yeah.
Or they lean in.
Yeah.
And use that back leg.
Or actually, a lot of the time, using your upper body to open car doors or help yourself out. I've had hip issues in the past and a hip replacement, and recovering from that. I mean, it was painful. And so what I did was usually grab hold of something with my hands and lift myself up that way.
Oh, yeah.
And so because there was less pain.
Yeah.
But it's so much of a mistake, because you get weaker as time goes on. And it's, so arms is,
exactly.
really
it's true, because when he gets up, he goes like this. It's like
and he uses the hands to push. Yes.
And then there's nothing happening anywhere else. Just sorry. And then,
no, but it's not just, I find I do that too, and I teach all this, and I find that I do that too.
And then the floor gets really scraped up where that's all happening. Sorry.
This is the beat up Duncan session.
So these little things for pelvic floor are really just simple awakenings.
Yes.
Of breath.
And that's what a lot of people tell me, like, why didn't I know this so long ago? I'm like, if it were my choice, the second that women like start to get their periods, even like we talk about sex education, but what about just like telling them about their own bodies, what happens with their own bodies, because we're already getting these young athletes who are getting pelvic floor issues. And I'm included in that. Like, I remember being in high school volleyball, and everybody's back hurt. Like, everybody's back hurt. And low back pain to me is a pelvic floor issue. So now I know that. And I remember our coach being like, well, it's because your abs aren't strong enough. Your abs aren't strong enough. And he made us do more and more crunches, you just need to strengthen your abs more. And he was headed in the right direction, but not like quite, because I didn't even think about my abs and my core and how they're related. So if you think about your abs, everyone, when they think about their abs, are like, oh, the six-pack muscle, right? So there's that. That's what people usually think about. But your transverse abdominis, that's the inner soda can wall. That's also a big part of your abs. And if you are just constantly working on that rectus abdominis, the six-pack muscle, without having proper TVA, transverse abdominis activation, then you're just constantly putting more and more pressure down on your pelvic floor. So if you think about a balloon, if you squish the balloon or if you flex the balloon and there's no support coming from the deeper core muscles, the pressure is going to go somewhere. And for women, it ends up going to their pelvic floor. For men also have this issue. Also, they get more hernias. Yeah. So we get pelvic floor issues. Men usually get hernias, but they also can have pelvic floor issues also.
Which actually a lot of pelvic floor issues are actually hernias by definition.
Oh, okay.
It's a weakness in an area that, and a lot of those, it's fascial tissue that can't easily be activated or increased in strength. So it's very, as you say, it's all connected. But we all need what you're talking about. I mean,
Yes.
we all need to come to your classes.
Yeah.
Yes.
Come
So-
on down.
But I want to bring something up that, because I want, this isn't quite a challenge to you, but it's an experiment. As a OBGYN and urogynecology practice to an extent, I mean, I have done a lot of pelvic floor surgery.
Mm-hmm.
And so I see patients that do need surgical repairs and so
Yes.
on. But one of the companies that I've been working with over the last few years developed an electrical muscle stimulator.
Mm-hmm.
And a couple of companies are doing that just paddles that go on the abdomen or the quads or hamstrings or whatever, and will twitch the muscle. They'll send an electrical current through, contract the muscle. Sort of easy but cheating way of doing sit-ups and so on.
Yeah.
We have this particular one that goes in the vagina.
Mm-hmm.
It's called V-Tone, and it's placed in the vagina, and it's comfortable for a patient in there. And then we gradually crank up the power on this. And about every 5 seconds, there'll be an electrical stimulus to the pelvic floor muscle that it's whichever ones it's activating.
Mm-hmm.
And that's what I want to use you for, because I want you to try this.
I would actually love to.
And
That's
see,
actually something really interesting to me.
yeah, and say, okay, now, because most of the time patients just sit there, lie there on their phones, don't pay much attention,
Yeah.
because and they can crank it up themselves.
Yeah.
It's not dangerous to do so. I mean, if we maxed it out and just turned it on for a patient, it would be very painful. But if we start slowly and gradually increase it, they can get to a certain level easily. And then if they can have the ability to turn it up themselves, because we've shown them how to do that, they can get stronger and stronger contractions that way, and a better effect from it. But I'm just wondering whether you're going to be able to interpret the contraction that you're getting to a particular pelvic floor muscle.
Yeah, I would actually be really interested in that, because
and applying the breathing.
the
when
breathing,
you're
I think that
doing
applying that breathing to it would really help, especially if you're in that, like we scroll our phones, but we don't always realize that adds another layer of stress. Like just scrolling your phone, like looking through Instagram or getting a text message from someone, like that. It's all little things of stress that actually do start to turn off your diaphragm, because using secondary breathing muscles, it's a stress response.
Or your posture, even when you're holding your phone.
Yeah. Like I always have to tell my kids, like when they're watching TV, I'm like, don't sit like this. Like, please sit up straight. They don't watch that much TV, but when they do, I'm like, please don't just like, ugh.
Yeah. And
so I would be interested to see that and to incorporate diaphragmatic breathing into it, and making it, instead of just like I'm just going to withdraw from my body while this is happening, like actually think about it and see like how it feels with you. Yeah, that would be really interesting. Because so I have a question for you. How does this help? You've probably had women who've come in who are postmenopausal, and I always get a lot of women who ask like, okay, well, like sex is painful now. And that's a big bummer to like not have that connection with your partner anymore. Right. So how have you done that with women who are postmenopausal? Does it help them with like vaginal dryness? And
that particular application doesn't help that problem. Okay. But I love the fact that you, in a lot of what you've written and what you've talked about, is empowering women, because that's so important in all of this, because women's health has been neglected for so long, or at least not paid enough attention to, and particularly perimenopause and menopausal times. One of the companies developed this piece of equipment that has multiple applications, including this one I'm talking about. It's called V-Tone, and the machine is called Empower. RF,
oh, okay.
Empower radio frequency. You've probably heard of Morpheus. It's a skin treatment.
Okay. Yes.
It's a skin treatment using bipolar radio frequency and microneedling, and initially on the face and other areas of the body, but it's been adapted to be used in the vagina, and we can treat those issues of pelvic pain, vaginal dryness, pain with intercourse. Everything is that the mucosa's got thinner, less blood supply. Nerve endings are closer to the surface, so there's more pain. The tissue doesn't stretch as much. It bleeds sometimes because of the lack of elasticity. So there is a lot of attention given to this. I mean, this is a big focus of my practice, is making women functional again for their benefit. And it's so there are other things, but for the patient with incontinence, particularly stress urinary incontinence, the V-tone works well in conjunction with these. So if we do 3 treatments once a month for 3 months of the microneedling vaginally, which sounds horrible, but actually is very well tolerated by patients, even without any anesthesia, but almost always we use some local topical anesthesia. But using that and the V-tone, so we're getting the muscles as well as the mucosa as well prepared and repaired. So it's big business.
And that's, I mean, I find that a lot of women, this isn't a problem that just started overnight. It's been building up for years and years and years.
Absolutely.
And so it's nice to have like that as an option, you know, like I didn't even know that actually existed until I heard one of your podcasts about it, actually.
Yeah. Well, I mean,
I was like, oh, that's interesting. Like I have clients who would probably like that.
Women are more active than like our moms were. Or, you know what I mean? My mom wasn't working out, doing weights or running or playing school sports or anything like that. So
we're much more active now.
As time's gone on, women are definitely way more active than they used to be, which now these problems are more common than they used to be.
More common, and stress is more common. And we're always told like, oh, decrease stress. You just decrease stress in your life. And sometimes I have women with 2-3 kids. They're like, how do I decrease the stress? I can't just like, here, take that one.
And you said you don't believe in the extreme physical fitness anymore like before. So go into that.
I feel like I just set myself up from probably freshman year of high school on to just continually mess up my core and my pelvic floor. So like I said, volleyball, and then I would take all the crazy kickboxing classes, you know, and like even then I remember like, oh, well, yeah, peed a little bit when you did an air jack, you know, and I was young. I was in my 20s, you know, at this point. And so for women, I tell women, if something makes you happy, do it. So I'm not telling anyone to like not do that workout. Like if it makes you happy, that is giving you something that, you know, you need. It brings you joy. But if you find that you are so depleted afterwards and you're doing all these high intense HIIT workouts and then you just feel depleted, that doesn't help your stress levels, because you're actually exercise is a form of stress. And that's why I like to incorporate diaphragmatic breathing and your breath work while you exercise, because you're kind of tricking your body to be relaxed and in a calm state while you're getting stronger. So like there's times where I lift weights and I feel like I had like a therapeutic session because I was breathing the whole time. And people always tell me after a Pilates class, they're like, I feel like I breathe better or sleep better that night. So it's like you still get the strengthening of your muscles, but you're not relaxed, but you're calm. You're in a calm state. And so for women now, zone 2 cardio is such like a hot topic right now. Like, oh, do zone 2 cardio, walk, and, you know, don't get to the point where you feel like you're going to be breathless. Like stay in zone 2, not 3 or 4. Yeah. If you are going to do HIIT, like you got to get up into zone 5, where you really are actually truly breathless. And then you let your heart rate come back down. And so I know that I was spending all of my workouts in zone 3 or 4. And what happens is your mitochondria, they either use fat as fuel or sugar as fuel. So when you're in zone 2, the reason why they say it's so good is because your mitochondria are using fat as fuel. And then once you get into zone 3 and 4, then it's supposedly using more sugar. And So that's just a way that women can like, one, kind of stay like more calm when they're working out because we have enough stresses in our life. And two, everyone's always trying to find that magic pill that gets rid of fat, you know? So that does help. And I tell women all the time, like, please just go for a walk a few times a week, even if it's 5 minutes, like get outside, get some sunshine. And like, I know if you need to cover up, wear sunscreen, yes, but get your sunshine, get your steps in, because it does make you feel better. You know, if there's nothing else you do during the week, try to check in with your breath, walk a little bit.
Mm-hmm. So I agree completely.
Yeah.
Just to put another emphasis on patients getting involved with something like this, it's just to point out how common it is. 50% of women who have a vaginal delivery will have urinary incontinence.
Yes.
Right, because, you know, if you look at the practice and what this is making clear is that it's not just postmenopausal women that have a problem.
Right.
It's
Absolutely.
younger women.
Yeah.
And you're seeing it all the time in your practice.
Mm-hmm.
And what's your age group? What would you say?
You know, it's funny. I actually feel like I got into this and I was like, I want to help pregnant women and people right after they have a baby. But what's happened is that I am now getting women who are either in perimenopause or postmenopause, who've had kids and who've lived, like their kids are in their 20s or 30s or 40s, and they've lived with these pelvic floor issues from giving birth, and they just lived with it for that long. And then they come and see me and they're like, I didn't know that it wasn't supposed to be like that, you know?
Yeah, absolutely.
And it's just something that they've lived with. And so it's interesting. I still work with a lot of pregnant women, and after they give birth, I work with them. But I find that now I actually work with women who are probably in their like 40s, 50s, and 60s.
Absolutely.
Yeah. So it was a shift. And I also feel like women are finally like, wait, I can do something. Like they are getting more empowered. Like I can do something. There is something. Yeah. And it's great to see, and it's fun to work with them and to help them feel empowered in their own bodies.
Yeah. You know, OBGYN's always been a great specialty. It's been really enjoyable with basically looking after healthy people in magic moments of their lives, basically having kids and so on. And then as I've grown older, my practice has grown older with me. And so my patients are no longer 25 or 30 or 35, although some of them are, but they're more 50, 60, 70-year-old people. And they have forgotten about the things that they used to enjoy, such as sex. I mean, they try and it's painful and they stop. And so there's so much we can do now. And that's put a lot of fun and laughter and enjoyment into people's lives and into the practice of gynecology.
Yeah, that's wonderful.
We've got happy patients again.
Yeah.
You know, that suddenly they can have sex again without it being, without pain, without it being, I mean, that number of patients that I see that haven't been able to have sex for 10 years because of pain.
Yeah.
And we can fix that.
Yeah.
So I'm lucky having that sort of specialty.
Yeah.
And that experience. That's good. This has been tremendous. I've learned a lot, but we have more work to do.
It's never ending. But it's
we're gonna arrange for you to try the V-Tone.
Yeah, we should for sure.
Yeah, I mean, I think this will be interesting for you to try it.
Yeah.
To see.
Yeah. I actually just heard of something last week that is red light therapy for your vagina, and so you have like a wand that is red light therapy that you like stick into your vagina, and you relax and you breathe with it, and it's in there for 10 minutes, 3 to 5 times a week. And I was like, oh, that's another one I want to see, because we use red light therapy for like our face and for collagen production. Yeah.
Is that what it's for?
That, and also to help stimulate blood flow. So essentially what's happening with our face and our skin, up here, it's happening down there too.
Absolutely.
Yeah.
And we don't do anything for down there. We're like, we put all the creams and stuff on our face. And I mean, we shouldn't put any of that on down there, but what else can we do? You know, we're in an age of technology. Why not use the technology?
The other thing that is sort of forgotten about this a lot of the time is that there's so much involvement of hormones or lack of hormones.
Yeah.
And so that's often
a huge
crucial
part
of the practice
Yeah.
of replacement hormones.
Yes. And every
for women
time,
and for men.
oh,
too.
yeah.
So
I
it's
have
helpful.
women a lot of time who if they're postmenopausal, we talk like, have you had any sort of hormone replacement therapy? Have you done anything like that? Because that will tell me where they are with their bodies and if they even know to do it, which I hope they do. And
well, there's been some unfortunate misinterpretation of data from studies and so on that have put set hormonal replacement therapy backwards.
Yeah, and there's like a whole group of women who missed out on it, like a whole age group. I feel that.
Right. But we're getting over that now.
Yeah.
So
yeah,
things are better.
Vaginal estrogen.
Yes. Yeah, I've heard about, and I tell my clients, because like I said, I just found out about what you do. And so that's usually where we go. Like we talk about like how to increase blood flow just through actually just being aware of your pelvic floor and like those pelvic floor contractions and like matching it with your breath. All of that helps to bring awareness to the area instead of just having it be like, I don't want to think about that. I don't want to have anything to do with it. So that's kind of like where I help them just become aware of the area. But then like I've had clients who come and they complain about vaginal dryness, and we do talk about estrogen cream a lot for them down there.
Yeah. Well, good.
Yeah. Well,
I think really good.
I think if there is something that I would tell women to do, if there's just a few things, it would be that diaphragmatic breathing, like really thinking about using their diaphragm. And if they are still like, I don't even know, like you can find a bajillion videos online. You can find my website. You can come to my class if you're in Santa Barbara.
And your
core sport.
Core sport.
Yes, core sport.
And where are your classes?
So we are by off State and Las Positas.
Okay.
Yeah. So there's Harry's in that shopping center and Gelson's. And so we have our whole Pilates studio. We also have there's a Pilates studio with the reformers in it. We have a group exercise room where we have bikes for cycle classes, spin classes. We have TRX, we do weights. So we're not like Pilates, like you have to do Pilates. We're like, no, you should do Pilates, but you also need to lift something heavy. You need to get you need to sweat every now and then. Like we want you to have a full rounded workout.
So are you in that space right next to where Harry's is?
We actually have 2 locations in that same shopping center. So we have the Pilates and the group exercise studio, and then kind of around over by Harry's, we have our wellness center, and that's where we do a lot of our private training. We have reformers over there. We have full gym equipment over there.
Where's the other space in that space?
They're in the same. So one is so if Harry's is in the middle, one is up farther towards State Street, and the other one is between Harry's and Gelson's. So we're always walking back and forth.
Where the day spa used to be?
We're right next to the day spa.
Okay.
Yeah, so that's still there.
Okay, I'm always in that shopping center. So.
And it's kind of like hidden. People will be like, I go here all the time. I'll be walking out of work and be like, I didn't know that you were here.
Is it where the back store used to be?
The shoe store. So Relax the Back is still there. It was the shoe store that was there.
Okay.
Yeah.
Got it. Well, we're in that center all the time.
Yes, so you are.
Yeah, come on by.
I'll definitely come by for sure.
Yeah,
thank you so much.
Oh, thank you both. This has been amazing. Yeah. So, and great to meet both of you.
My pleasure. Thanks. Well, thanks for listening. We're getting really good feedback. We'd really appreciate a review on Apple